Many symptoms of social phobia are seen in the main character, Barry Egan, from the movie Punch Drunk Love. Barry Egan is a Caucasian male in his early to mid-40s who lives alone in an apartment in Los Angeles, California.
Barry can be described as a socially awkward individual who does not seek out or actively engage in social activity with others.
It appears that Barry has little to no family support system, and that his relationship with his 7 sisters relates to his low self-esteem. He constantly apologizes for things even when he did not do anything wrong, and stumbles with his speech by merging words together.
Barry becomes very anxious in social situations. He endures these situations with intense anxiety and distress, which sometimes can lead to a panic attack following the interaction.
Barry has a tendency to become violent when provoked with embarrassing stories from his childhood. He is known to lie and deny his actions when confronted. According to the DSM-4, a person with social phobia will display a marked and persistent fear of one or more social or performance situations in which the person is exposed to unfamiliar people or to the possible scrutiny by others. The individual fears that he or she will act in a way or show anxiety symptoms that will be humiliating or embarrassing. A person with social phobia will either avoid the feared social or performance situations or else endure them with intense anxiety or distress. Barry demonstrates these characteristics frequently throughout the movie. In the following scene, Barry tries to avoid interacting with strangers and even expresses to his sister why he doesn't want to meet a friend that she is trying to set him up with.
It's your sister.
Hi, how are you?
Hey, Elizabeth.
How's it going?
It's going great.
Stop by and say hello.
Terrific. What's doing?
So, you're going tonight, right?
Yes, I'll be there.
Cool.
You're going?
Yes, I am. Actually, I came by to talk to you about something in particular. There's this girl, this friend of mine from work, who I think is really cute and really cool, and I want you to meet her. So I was thinking about bringing her to the party tonight. What do you think?
Yeah, I don't want to do that.
Why?
I don't do stuff like that.
Well, you don't really do anything.
Everybody would be looking at me.
So? What's wrong with looking at you? It's a free country.
I just feel like I would be a little tense, and I don't think I'd act like myself.
Well, that's kind of your fault.
There's an outside chance I'm not even coming tonight.
Oh, really? Everyone said you were coming. Didn't you tell everybody you were coming?
I have to renew my gym membership.
Oh, right. Oh, God. Well, that solves everything, actually. If you're not going to come, then I can just bring her. It's not that big of a deal. Oh, well, it'll be fine. Great.
Please don't.
Just trying to be your friend, Barry. Hope you can make it.
The DSM-4 states that the avoidance, anxious anticipation, or distress in the feared social or performance situations interferes significantly with the person's normal routine, occupational functioning, or social activities or relationships, or there is a marked distress about having the phobia.
Barry's fears seem to include most social situations. It appears that Barry works well with the other men in his company, but his interaction with his co-workers is limited and somewhat awkward.
When a person with social phobia is exposed to the feared social situation, it almost always provokes anxiety, which may take the form of a situationally bound or situationally predisposed panic attack.
In the following 2 scenes, Barry's reaction to his sister's demoralizing remarks about him result in panic attacks that take the form of Barry kicking out the glass at his sister's house and vandalizing a public bathroom.
How's work?
Business is very food, thank you.
What's very food?
What's that?
You just said very food.
Oh, I'm sorry. I meant to say very good.
Maybe you said food because you're hungry. You know, gonna eat.
That makes sense. Is your friend here?
No. You're off the hook, Barry. You couldn't make it.
Thank you.
You nervous?
No.
You look nervous.
Feel very happy.
Good. Did you get your gym membership?
Tomorrow.
Hey, I had a girl that was gonna be for Barry. She wouldn't let me do it. Sorry, this girl is gonna bring her in, and she's totally awesome. We work together. Yeah. And he said that.
Come on, gay boy, it's time to eat.
Who's he gonna be? I don't know. He's like,
Maybe he's just worried that we're gonna give him a bunch of shit.
he said he wouldn't come if I brought her. He
did?
He's such a fucking asshole. Well, I don't know. I was totally gonna bring her. It would have been like totally casual, you know? Like, it really would have just been.
Your sister was telling me a pretty funny story about you. And when you guys, when you were kids and you were building a ramp for the dog and you threw a hammer through a window, you threw a hammer straight through a sliding glass door. Is that right?
Threw a hammer. I don't remember doing that. My sister's a liar. I have to go to the bathroom. Okay. Sorry.
A person suffering from social phobia will most likely recognize that the fear is excessive or unreasonable.
Barry did not know exactly what was wrong with him, but as we see in the following clip, his attempt to reach out to his brother-in-law showed that he knew that something was unreasonable and that he needed help.
I'm sorry about that. Sorry about what I did.
Sorry.
I wanted to ask you something because you're a doctor, right?
Yeah.
I don't like myself sometimes. Can you help me?
Barry, I'm a dentist. What kind of help do you think I can give you?
I know. Maybe you know other doctors.
Like a psychiatrist?
I just don't have anybody else I can talk to about things, and I understand it's confidential with the doctor. And I don't want my sisters to know, okay? Because I'm embarrassed about this.
All right. Barry, if it's about getting a phone number for a psychiatrist, I can do that. It's not a problem. But what exactly is wrong?
I don't know if there is anything wrong because I don't know how other people are. I sometimes cry a lot for no reason.
Both pharmacological and psychotherapeutic interventions are quite effective for this disorder. While combining the two does not appear to show benefit over either alone, the effect sizes are quite large for both medications and cognitive behavioral therapy.
Therapy will also help give him coping strategies to change his behavior in anxiety-provoking situations, as well as giving him the skills to help manage his emotions and violent temper. Exposure therapy will help Barry learn that he can handle social situations without anxiety. Cognitive behavioral therapy is likely the most effective treatment for Barry. This treatment will help change Barry's pattern of thought about certain events by helping him better understand the reality of the situation and encouraging him to focus less on the idea that he will be embarrassed or humiliated. Barry's character in the movie gave an excellent portrayal of someone suffering from social phobia and the struggles they must face on a daily basis. The portrayal of his 7 sisters gave a good indication that his upbringing was a humiliating and traumatic experience and gave insight into reasons why Barry might suffer from the disorder. Barry's relationship with Lena is less accurate to the real-life relationship someone with social phobia might experience. His awkward demeanor, inability to maintain eye contact, and lack of conversation skills were accurately portrayed. The manner in which the two met was also likely since Lena pursued Barry and made most of the first moves in the relationship. The inaccuracy is in the fact that Barry and Lena found love and appeared to live happily ever after, which unfortunately does not happen for many individuals diagnosed with social phobia. These factors do not exclude social phobia as a diagnosis for Barry. They are just not the norm for what one might expect for someone diagnosed with social phobia.